Nearly 20 years ago, thanks to the leadership of Congresswoman Nita Lowey, we initiated the Open Door School-Based Health Center program to bring our health centers directly into local schools to improve access for low-income children to healthcare and wellness services. At Open Door, we care for thousands of families every year who face many barriers and daily struggles. Through our work, we level the playing field to make healthcare more equitable. We know that children need to be healthy to learn, and school-based health centers are correlated with improved performance in school. Congresswoman Lowey's leadership and the funding she provided cemented the relationship between Open Door and the Port Chester School District, and then we were off and running, initially in 2 elementary schools. With critical support from the Frog Rock Foundation, the program took hold, and we were able to operate in every school in Port Chester and later duplicate the program in the Ossining School District. I can't emphasize enough how important this program is in the lives of the families Open Door serves. Because we are a permanent fixture in each school building, health and wellness is an important part of the fabric, and children and their parents have a trusted and caring clinician at their disposal. Today, we want to take a moment to recognize Congresswoman Lowey's extraordinary contribution and the support that made this all possible, and to memorialize her legacy that will continue to benefit thousands of local families in Westchester and beyond.
Nita really helped support the development of our school-based health center program at Open Door. She supported our work. She was an incredible advocate and an ambassador for the work that school-based health center programs do.
She asked a simple question: aren't schools a place where families can feel safe and where there are people that they can trust and go to for help?
Since the beginning of Open Door's School-Based Health Center program, we have served over 12,000 students with over 200,000 visits.
The history of school-based health centers in Port Chester dates back to the late 1990s. Open Door worked collaboratively with Congresswoman Lowey to secure funding that would create the school-based health centers in the Port Chester public schools.
Back then, we saw too many children and teens who couldn't get into school because they lacked the required immunizations. We realized many had healthcare issues that were not fully being addressed, and we understood that these families needed a highly accessible healthcare home with clinicians especially attuned to their needs.
Nita looked out for our nation and our neighborhood. She helped bring quality health care to friends and neighbors in our community who could not otherwise afford it by always representing us so well in Washington.
Providing routine health care, immunizations, and early intervention for evolving medical needs ensures that children come to school each day able and ready to learn.
So children could receive medical care, dental care, immunizations, important health screenings, and so much more.
National studies indicate that students not enrolled in a school-based health center lost 3 times as much class time as those enrolled.
By being located within the school buildings, the staff of the school-based health center program become a part of the fabric of the school. It enables children, particularly our vulnerable population, to limit the time spent out of class.
We have hundreds and hundreds of students that participate in our school-based health center, and because of that, they're more ready to learn, and they're just healthier as they move on and travel throughout our community.
Educators throughout New York State and the nation at large have now learned that schools can indeed serve as hubs for their community.
Parents can rest assured knowing that their children are being cared for by a care team without the burden of time or cost to the family at a convenient location that meets students where they are, at school.
Families don't have to lose valuable work hours by having to take their kids out of school and taking them to very important medical visits.
By supporting school-based health centers, you're building the foundation so all children can come to school healthy and ready to learn.
None of this would be possible without the advocacy and support of Congresswoman Nita Lowey. And so as we continue expanding the program and moving into new communities, we are overjoyed to rename our school-based health center program the Nita and Lowey Center for Health in Schools. Thank you, Congresswoman Lowey. Your legacy endures in thousands and thousands of healthy families and children. We wish you well.
Thank you, Mrs. Lowey, for your dedication, support, and tireless advocacy in making school-based health centers a reality for all students in Port Chester, and for supporting our common vision of healthy students, healthy schools, and healthy communities.
Thank you again. Wish you many years of happiness in retirement, and thank you for your dedication and service over the years.
As a staunch supporter of Open Door Family Medical Centers and as a personal friend, we thank her for her many years of service, her kindness, and her friendship.
I think she's truly an inspiration for so many people that believe that health equity transforms people's lives.
Thank you, Nita Lowey, for asking the right questions, advocating for the right causes, and for your support and leadership throughout the years.
We are grateful to Congresswoman Lowey and to Lindsay Farrell at Open Door for recognizing this important need for children and their families in our community. And as Frog Rock, we were proud to support that effort.
On behalf of the students, the parents, the educators, and all of Open Door, thank you, Congresswoman Lowey. You are our school-based health center champion.
Hello, it's Congresswoman Nita Lowey. I am so touched by this honor. I would like to thank Lindsay Farrell and all the amazing health providers and staff at Open Door for this recognition and for everything you do to improve the health of our community, especially during these difficult times of battling COVID-19. I only wish we could be together in person. I cannot believe that it's more than 20 years since I first secured federal funding for the school-based health center at Thomas Edison Elementary School. Back then, Steny Hoyer and I had an idea to create a pilot program that would bring community health centers into local schools, creating full-service community schools that would ensure every student had access to the health care they need to succeed. And my, what you have accomplished. Because of you, thousands of young people have had a healthy start, which has improved their overall health and their education. These children will lead our community for years to come and inspire me every day. It has been a great honor to work with you and serve my community over these 32 years. Again, I thank you for this recognition and for all the amazing work you do.